is a YouTube presentation by Dr. Ashish Joel from the Implant Academy. Now here is a case of immediate implant in which we extract the root atraumatically. We go ahead with the curettage of the socket to make sure that the socket is completely clean. After the complete debridement of the socket, we start with the drilling protocol and make sure that we drill into the palatal bone and not through the socket. This is the lance drill. And we make sure that the direction is absolutely parallel to the adjacent tooth. Now we come to the first drill, the 2.0 drill, and we drill into the palatal bone and make sure that the occlusal clearance is adequate. We go ahead with the 2.8 drill. And since the maxillary bone is a porous and a soft bone, so in order to get adequate primary stability, we go ahead and insert our implant. The implant we are using is a one-piece implant of 3.75 diameter, 11.5 length, and here we go. We have adequate clearance and we are ready to load the implant. With the ratchet, we give the final turn.